Good evening. It was a beautiful day today. It's a beautiful evening. We'll get started in a couple of minutes. Hello there. I hope everybody had a good day. I'm Jeff Jagir, and I'm the host for the monthly cancer prevention and wellness series, sponsored by the Cancer Survivors Park Alliance. Tonight's subject for cancer prevention and wellness is living with uncertainty. A couple of housekeeping things before we get started. As the audience, you will be muted. That is not to imply that we don't want and seek your questions or your comments. So those can be registered in the chat function, which I will be monitoring. And our speaker will get those as they come in. We are recording this session, and like all of our cancer prevention and wellness, since we went virtual, we've recorded these and archived them, and this session will be available on the Cancer Survivors Park website, which is cancersurvivorspark.org. And you can see all the archived sessions there too. So if there's a subject that really applies to you or has meaning to you, please go to that site and go under programs, and you'll see the cancer prevention and wellness there. Tonight, we have a very important and very real topic to our population. Life is certainly uncertain enough, and a cancer diagnosis or any significant diagnosis adds weight to that burden. So dealing with uncertainty becomes a major component of how and how well you live your life going forward. Kerri Susko is our speaker tonight. She's a licensed independent social worker doing clinical practice with oncology social work certification. She has a very busy practice that she maintains at Prisma's Center for Cancer for Integrative Oncology and Survivorship, CIOS. And she is also the director of the Cancer Support Community, which has an office at Prisma, but also an office at the Center for Hope and Healing in the Cancer Survivors Park. So we're going to get her expertise about how our patients and survivors and caregivers deal with this unavoidable thing we call uncertainty. So Kerri, thanks so much for being here and sharing your expertise.
Thanks, Dr. Jagir. As you said, this topic is so interesting because really, well, all of us and certainly all of you have lived with uncertainty throughout your lives. It's the basis of human existence is really uncertainty. But we don't really think about that, do we? We keep it very abstract. This society keeps it at a distance, and we really don't acknowledge it. on a daily basis necessarily. We really don't like to address it. But it's a fact. It's a unavoidable and natural part of life. We run around on automatic pilot, pretending it doesn't exist. But as Dr. Jagir said, when you're faced with a cancer diagnosis or another serious illness, or something traumatic event in your life, it really comes right to the forefront and kind of slaps you in the face.
What they said.
So tonight we're gonna talk about that weighty layer that's on top of all the other layers that you may have already been dealing with. And that weight, it can be pretty severe. I wanted to talk about it first from the standpoint of change. So, with the diagnosis, as I'm sure you are painfully aware, or, I feel like I'm preaching to the choir to say that it happens quickly. It's not like our usual change where I realized all of a sudden, wow, when I was a kid, I could do a cartwheel and now I can't do it. Or
you should.
When I was 20, I, had a fuller head of hair. A cancer diagnosis brings very abrupt and significant changes very, very quickly. And it's not only the tangible changes, but perhaps the way in which one thinks, the things that were expected, the ideals that you had, those all become challenges because those things change quickly too. So I just wanted to mention some of those changes to emphasize this point. So, in terms of physical appearance, as I said, like you can see on this slide, hair loss, weight gain, skin changes, actual loss of physical parts, those things may happen in life, maybe slowly or quickly, but with a cancer diagnosis, it's forced and thrust upon very quickly. The ability to carry out daily tasks or to function in the same way often changes. Fatigue, where everyone can relate to being tired, but fatigue with cancer is a completely different thing. Strength becomes a very different thing. Mobility and stamina, those things change very quickly. Spiritually, maybe we may have thoughts about the meaning of life sometimes, but when a diagnosis hits the questioning around the whys of things, existential angst intensifies greatly for some people.
And that fatigue thing, I think you mentioned the fact that it is more than the fatigue you have at the end of the day.
Right.
If you haven't had a good night's sleep or that sort of thing, it is an overwhelming fatigue. And there's somebody who said that fatigue makes cowards of us all. And it's hard to have any major psychological reserve or empowerment when you have that kind of fatigue. So it just makes the ability to deal with things more difficult.
Absolutely. And I think even like you were saying, when we have skills that maybe have helped us to manage stress or push us forward, when physically you're not feeling well and when you're experiencing that type of fatigue, it's hard to implement any of those skills. And I remember a patient saying to me once, she was in my office, obviously, because she had a cancer diagnosis, but her sister had had breast cancer the year before. And her sister was saying, I can't even talk to you on the phone. I'm just too tired. And she was like, I said, that's ridiculous. How can you not be able to talk on the phone? And she kind of poo-pooed the whole thing. but she was now in my office saying, I completely understand. So I think another layer of that is also the fact that oftentimes people around you, your support system, as much as they want to be there and understand, some of those adverse effects they really can't understand. And that kind of brings us to the emotional changes and sort of uncertainty, because universally, I think that there are emotional adverse effects that go along with treatment. We humans like to feel in control and have a sense of security and stability, and it's certainly difficult to have that feeling, to not feel anxious or worried when your health is on the line and the future is undefined. So with that, it brings a lot of questions, worries about what lies ahead in the future, about having to put things on hold, about finances, about not being able to perhaps continue to work in the same way, fears of treatment stopping working, fear of recurrence. And it's not only for the patient, but also for the family members, the caregivers, loved ones, wondering, having questions of their own and uncertainties of their own around being able to handle this diagnosis themselves, about potentially losing the person they love, about being able to continue on with their life, with their own activities. And I think also, wondering if they're doing the right thing, or, being a good caregiver.
Well, and on top of that, Kerri, there's so many of my patients in the past that the caregiver has to take on an entirely different role logistically.
Sure.
If it's the wife that can't go, the husband now has to deal with carpool and shopping, and may not be totally at ease with all those things. Mm-hmm. So it is very difficult, and then the person who's got the problem can feel guilty. It's just hard when you're in the midst. Thankfully, cancer therapy has improved to an extent that it's a little less toxic, but chemotherapy is still out there. And when you're as tired as you can be, and you have all these thoughts racing around, it's kind of hard not to catastrophize. And I hope we can get to the point where, if this, you say to yourself this.
Yes, well, I think, it's a good point that and we're going to get to that in a minute, but the way that what we do with the thoughts that we have is what you're talking about. What I can be concerned, but if it goes to the point of catastrophizing, that becomes a completely different beast, right?
Right.
So we'll be talking about that in just a moment. Sorry, I'm going too fast here with my mouse. Sorry, going backwards. There we go. So before we get to kind of talking about, okay, what do we do with this uncertainty? And again, I'm preaching to the choir, but I guess I'm doing that in an attempt to universalize some of these feelings and thoughts, because I think it's important to recognize that there are some universal thoughts that everyone diagnosed does have, to differing degrees. But another layer of diagnosis is and uncertainty is sort of that in-between place. So having sort of had this, and then you're going through treatment, and then you're finishing treatment, and like, what does this thing over here look like? And so,
And Kerri and I have talked about this. So we always have these celebrations, and we thought it was just the natural thing to do. I mean, it is a time to celebrate if you're finishing up therapy. You've probably read lettered that day for a long time. This is when I'm done. But when you go through the celebration, there's this other aspect, that other thought that enters your mind of, okay, since the diagnosis and I saw the doctor, I've been getting this therapy, and I assume my cancer's been getting this therapy, and this therapy was supposed to take care of my cancer. But what happens now that the therapy is over? I hopefully am going to get stronger. I'm going to get better. But so there's still thoughts, no matter what your prognosis.
Yeah, right. And the uncertainty of, will things return to the normal that I had before? Doctors call it the new normal, right? Which for me, that connotes, the connotation is sort of negative, because it's kind of like your new normal. That means I have to accept something lesser than I had before. And maybe that's not what everyone thinks about, but that kind of plays into my mind. And I think that it's important to recognize that things are maybe different, but that doesn't mean less than. But for individuals going through treatment, it is important for those successes and those celebrations around milestones. At the same time, as you just said, Dr. Jagir, there's changes of perspective and questions around other people around me. Their perspective might not have changed. So how is this going to be? Am I going to be able to ultimately do the things that I was doing before? How is that going to look for me? And I wanted to read a passage from a book called Between Two Kingdoms. The author is Salika Jawad. And I just thought it was very apropos for talking about the in-between place. She says, everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. Susan Sontag wrote that in Illness as Metaphor. Although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. Salika says, by the time I reached my last day of chemo, I'd spent the majority of my adult life in that other realm, the kingdom of the sick, that no one cares to inhabit. Initially, I'd clung to the hope of a short sojourn, one in which I wouldn't have to unpack my bags. I'd resisted the label of cancer patient, believing I could remain the person I'd been, but I'd watched as my old self vanished. I'd adapted to the mores of this new land as best I could, befriending its inhabitants, even carving out a career within its confines. In its terrain, I'd built a home, accepting not only that I might stay there for a while, but that I would likely never leave. It was the outside world, the kingdom of the well, that had grown alien and frightening. For all patients, the end goal is eventually to leave the kingdom of the sick. And in many cancer wards, there's a bell that patients ring on the last day of treatment, a ceremonial tolling that signals a transition. It's time to say goodbye to the eerie and changeless fluorescence of hospital rooms. It's time to step back into the sunlight. That's where I find myself now, on the threshold between an old familiar state and an unknown future. I am left with the question of how to repatriate myself to the kingdom of the well, and whether I ever fully can. There's no treatment protocol or discharge instructions which can guide me on this part of my trajectory. The way forward is going to have to be my own. And so I read that to kind of bring us to a couple of things. One, that the universal truth of human nature is that transformation is inevitable. And it's actually really funny because we had a retreat the other day for cancer support community, and we had broken into groups, and we were talking about sort of our ourselves and what our own truths were. And then the question was asked as to, what do you think is a universal truth? And ironically, all groups that were there said transformation is inevitable. Maybe there were different verbiage around that, but that's basically what they all said. Meaning that change is inevitable and we are constantly transforming, even when we don't realize it. But certainly cancer brings that painfully to the forefront, that we are transforming. And so we come to, okay, so how do we do that in the best way possible and accept that when it's forced upon? Recognizing that, yes, life is a roller coaster, but certainly a diagnosis brings a whole new roller coaster to the situation. And sometimes there's twists and turns, and sometimes there's a few days of maybe straight shot, but then there's another twist and turn. And it highlights that things are inevitable and we don't know what's going to come next. And although we never did, how do we come to accept that roller coaster is there? How do we figure out how we can have moments of calm? How do we live our best lives when that roller coaster still exists? And so, I mean, I know you all joined this meeting tonight to sort of get that question answered or figure out perhaps some tools to use. And I guess I'll say that unfortunately that prescription is not easily prescribed, nor is it easily taken. But let's explore a few seeds to that we can plant. So I would say the main way of managing uncertainty is navigation, and maybe changing a word in our heads or changing the message around control or to navigation. Because that's really, control is really an illusion in so many ways. In fact, it's ludicrous to think that we have control of as much as we pretend we do. I also just want to clarify that I'm not talking about navigating sort of in a straight line from point to point. You are all too aware that on the road, you may think that it's a smooth road, and then you come across a pothole, and then you see things along the way that you didn't see before. Sometimes maybe there were a lot of potholes and you find that it's smoother on a given day. But I guess all I'm trying to say is that the road is never really the same, even though we want to try to pretend it is. And if we can figure out how to feel comfortable navigating whatever potholes and bumps come along the road, that's the key factor here.
And one of our participants mentioned the fact that, you can't do it by yourself. Sometimes you have to, and I think you have emphasized that group therapy, the help of community, other people that have other perspectives, things that have worked for them, and sharing that. So getting better with the help of community.
Yeah, absolutely. It's really hard with the amount of thoughts and emotions especially when you're alone, that can really take over, and it becomes harder to get space and perspective. So connecting with other people, even if you don't always agree with them, or even if it gets frustrating that everyone has their own opinion, I think it helps to create space and give you a chance to get some perspective. So one way to navigate is the grieving process. And I bring this up because so many times my clients have, when I've mentioned grief, they sort of look at me with confusing eyes like, are you talking about death? And I'm not talking about death, I'm talking about losses. Oftentimes we don't think of going through a grieving process due to losses. And it's important that we allow ourselves to go through that process. And I'm not saying that there's a particular way to do it or a particular time frame to do it, because there's not. But I think trite but true, there are the stages of grief. I put them in this slide. Again, I'm not saying that you have to go through every one of those stages or that there's a particular sequence of those, but I put this up because allowing yourself to move through it instead of avoiding it, to get to the point of acceptance of where you're at, is the way forward, is the way to, I say that with such confidence, but is a way of managing uncertainty. Being able to allow for discomfort and allow for the fact that things are not certain, accepting that place, accepting change and uncertainty, you're able to live very differently than when you are avoiding it, when you're averse to it and trying to run away from it. I don't know, Dr. Jagir, if you want to say anything.
Well, no, I think that you're getting a lot of support for the survivor support group as really helpful. And again, it is a roller coaster and everybody goes a different route, but there are guardrails and there is a pathway forward. And I think it's important to realize that, you know, like we mentioned to begin with, that life was always uncertain. I mean, we just got through memorializing 22 years ago, and you know, those people went to work, and you know, you just don't know. And I've had a number, it's not universal, but a number of patients who, and it doesn't have to be 5-year survivors, 10-year survivors. It can be, you know, people that are 6 months out that are almost feeling fortunate that they had this diagnosis that allowed them to wake up to life and to recognize it and not take it for granted.
Mm-hmm.
To recognize their relationships with friends and families, and look around and to be kind to themselves and that sort of thing. So it can transform you, but you know, once your mental fatigue gets better, your physical fatigue gets better, when you're feeling stronger, you know, you can look at this as sometimes a thing that interrupted your life, but is eventually going to make your quality of life better.
Absolutely. I completely agree with you. I think it speaks to the fact that oftentimes we are on that automatic pilot and going through life without really exploring things, and with trying to avoid things. And that change of perspective, that increased exploration and thinking, and maybe I mean, you can't help but have to allow for some discomfort, both physically and emotionally, that changes you. And I think it also speaks to the fact that the recognition that there are things that we can control and there are many things that we can't control. And if we are able to reel ourselves in and focus on those things that we can control, that leads to a very different feeling. Now, that doesn't change the fact that those other uncontrollable things are happening. But again, can we navigate? And when we are expending a lot of energy on the things that we can't control, we're not navigating. We're expending energy with no productive end. If we're navigating the thing and focusing on those things that we can do something about, we're going to feel differently. So, you know,
there is some pushback about, you know, worrying about cancer coming back. How could you that ever make your life better? And I get that. But it is a, you know, negative thoughts are not going to make you better. So, you know, perhaps deepening your relationship with the world you live in, and hopefully the Cancer Survivors Park is there to help you in that regard too. I mean, that space is supposed to be healing. And so between the cancer support community, Cancer Survivors Park, there's lots of things, but I know that saying that your life's going to be better is you know, somewhat naive, and I get it.
Was that a comment in the chat, Dr. Jagir?
Yes.
Okay, so
we're having a very active chat session, which is good.
Okay, so I mean, I think that's an important. This is important because different things, people have different thoughts about different things, right? So when we're talking about life, maybe the word isn't better, but how can you have your best life within the limitations and within the difficulties that you have? I guess that's what we're talking about, because I mean, heck no, nobody wants, I mean, having a diagnosis, is horrible, right? But what do you do with that? Because you can't get out of having the diagnosis. So I think what we're talking about is, how do you begin to build the steps to go over the fence to get to another place? Because you can't just jump over and be on the other side. So I hope this isn't taken as we're minimizing the difficulty, the myriad of thoughts and clutter and emotions, and I mean, from all different standpoints, but these are just some potential ways of perhaps managing some of those thoughts and emotions.
Well, the name of the series is Cancer Prevention, and so we obviously are trying to give them capabilities for preventing something that now they haven't prevented, and so there's obviously negative connotations. But the other aspect of this is, how can you live with that new normal, and maybe thrive with it, and because the quality of your life. I mean, I always told my patients that they cannot die figuratively before they die literally. And, clearly, if you don't enjoy the life you've given, no matter if it's been shortened by this cancer diagnosis or not, then it's kind of won, and you don't want to let it win.
Yeah. I mean, it's a lot easier to say than live, isn't it? Um,
No, it is. That's right.
so I also maybe should have prefaced any of these little try this with the fact that this may be like in a sense these simple concepts, like focus on those things that you control, not on those. It's a simple concept that's extremely difficult to implement, and none of us will ever be perfect at doing that. And some days it's a lot harder to do. I think we said that at the very beginning, that when you're not feeling well, when you're going through active treatment, when you're fatigued, like you may not be able to do it at all. And that's what it is. But I do want to say with this that sometimes it's hard to think about the things that we do have control of when so many things are out of our control, when we're feeling pulled by the waves, and it's like feeling like I'm not making any choices. So I think it is important to explore each one of you for yourselves, like what do you have control over in this moment? And I put just a few things on here because I think those are sort of universal things. Again, that doesn't mean that it's easy to focus on or easy to do, but exploring our own feelings and needs, exploring the messages that we have about certain things, determining whether those messages are still true or whether they are now false, figuring out how to communicate those feelings and needs to other people, exploring, learning different ways to respond. Well, I guess what I mean by that is different ways to pause in order to respond versus having an emotional reaction. How do we gain knowledge? Where do we gain knowledge? How do we connect with other people who can give us knowledge or give us perspective? And how do we tweak? How do we tweak things in our life when things are constantly changing? Which
So Kerri, let me just read some things from the chat.
Okay.
Because we're talking about a very emotionally charged subject.
Absolutely.
And so I think we're getting some very worthwhile and very reasonable pushback.
Okay.
While you both serve the cancer community, I wonder if either of you have had a cancer diagnosis. It's easy to talk about things, but unless you've experienced them, you don't really know the feelings we have.
Right.
There's another one, I don't like it, but I do know that cancer and even the fear of cancer recurrence has changed how I view and live my life. I probably would have been happier if I didn't have to navigate, in parentheses, I love that word, these changes. But I think the reality is that most people are going to face something like this. Next comment is, I can never leave that worry having had a recurrence and told it will come back again, not if, but when, by my doctor. I also know the cancer did make me a more grateful for all I have. Please, I mean no respect. I just wondered if either of you knew from personal experience or only professional experience. And Kerri, I have only relatives that have had a cancer diagnosis, but Kerri, this may be a good time, and to the audience, I did ask Kerri if I could ask about her husband's diagnosis.
So I haven't personally had a diagnosis. My husband had a diagnosis prior to my meeting him. He so he had Hodgkin's lymphoma when he was a teenager. And I guess it's first of all, I want to say you're absolutely right that we can never understand what you are feeling or going through. That's why I feel it's so important to connect in some way. And I'm not saying like a support group per se, but I'm saying in some way with others who have gone through a diagnosis so that there's a connection with someone who understands on a different level. But I also think from knowing how my husband is, when he was diagnosed, there weren't any programs, there weren't a lot of support groups, there, mindfulness was not a mainstream word or topic. And so basically, his, I guess I'll say journey, has been avoidance and a lot of triggering of bad memories. And albeit that these things are very difficult and are work for the individual, if we're talking about how to have how to get through something, I think that engaging in mindful practices, and I think that's really what we're talking about, of pausing, of being in the present moment, of I was going to get into some of these other things, but focusing on gratitude, of defining for yourself what you want and need, or what happiness in this moment would mean. And when I say in this moment, I'm saying one's best changes from day to day. What happiness might be might change from day to day. We're looking at this slide that says wellness. I mean, that could change from day to day as well. So I think these internal ways of managing difficulty, I truly believe that they can be helpful, even though I don't and can't really know how you are feeling. I guess, again, we're offering seeds. Some can be planted, some can be thrown out. They all can be thrown out, but like I said, it would be great if there was some, I guess the title of this, living with uncertain, I mean, we all are living with it, but there's no prescription on how to do it well. And so it's sort of like trying different things, just like sometimes we try different medications to see which one is going to work the best. It's sort of the same with our emotional health as well. I mean, we can try different things, and some will work and some won't.
All right, let's move on to mindfulness and see what kind of things we can offer here.
Okay, so these are kind of different, a few different thoughts that I had. So when we're talking about having a lot of clutter a lot of different thoughts and emotions, all edged with perhaps anxiety and stress. Being able to shift attention from those thoughts, even momentarily, can be helpful. And when I say momentarily, I really mean momentarily, but perhaps incorporating a shift of attention intermittently throughout the day so that the pressure of all that one is dealing with can be a little less intense. And one can shift attention with the use of breath or with the use of any of the senses. So I can certainly go into more detail about focusing on breath. I guess here we're just talking about all different types of meditative practices. The cultivation of self-compassion. Oftentimes it's really easy to be compassionate or kind to others, even others who are going through a similar experience. Often so freely and easily we give that kindness to people that we know, but it's a lot harder to give that to ourselves. And exploring how we can be compassionate towards ourselves, not only in behaviors and activities, but also in how we are talking to ourselves, being more aware of our internal dialogue is important. Dr. Jagir mentioned gratitude. Human nature, I guess, unfortunately, we often are focusing on the things that we don't have or we didn't do, and using some sort of gratitude practice on a daily basis may be helpful. And I'm not talking about like toxic positivity. I'm not saying like, oh yeah, everything's great, but usually there's something that we can be grateful for. Again, not trying to minimize the things that are difficult. Balancing, so making sure that there are the balance of things that are draining, and this, I'm sure there's going to be comments about this, but things that are draining with things that are nourishing. So, I mean, that's not, obviously that doesn't stay in perfect balance, but whatever we can do to increase the level of balance. So there are certainly things that you have to do. You can't say, oh, I don't feel like going to my treatment today, but perhaps tweaking that event, tweaking what you're doing in the car on the way to treatment, or what you're doing while you're sitting taking treatment, or the how you're thinking about certain things, or distracting while you're involved in it, so that there aren't ruminating, perseverating thoughts. But also what gives you nourishment, really exploring what does that look like, and incorporating more nourishing things, even if those are only momentary things, like taking a 2-minute break to focus on breath. That can be very nourishing and give you a different sense overall. A metta meditation, bringing intention, the intention of just, may I deal with this in the best way possible. Using those types of verbiage, being aware again of internal dialogue and how you're talking to yourself. Allowing for uncertainty and discomfort, instead of trying to push it away and get away from it, being able to move through it in order to get to the other side. And when I say the other side, I'm not saying the other side is this bright and shining and beautiful, easy place, but I'm saying that it's a different space. And then just being in the present. The present is the only place that we have any control, or that we are able to navigate. I don't want to use the word control, because I can't do anything about what's already happened. I can go back in my mind, I can rehash, I can replay, I can bargain, I can deny, I can do all these things, but I can't change what's already happened. The future is undefined. And that's a place that certainly we humans love to go. And that's where all of our anxiety and worry comes from, is all those what ifs. And we can't be proactive in some ways, right? I can carry an umbrella if it's going to rain, but that doesn't change whether it actually rains or whether it doesn't. So if I'm able to bring myself back to, okay, this is my reality in the present moment, if I can work on accepting my present reality, and if I can change the trajectory of my thoughts so that I'm not ruminating over what may happen, but focusing on what is currently happening, or what I can do, or what I am in control of, or what I have in this present moment, that is helpful in changing mood and in decreasing spirals of depression and anxiety. So again, I guess the whole point is all those what ifs, there is definitely uncertainty. There's no way out of that. But if we utilize, or, see how some of the tools that maybe we can learn to navigate, if I can navigate those what ifs, aren't playing the same role, and I can jump from rock to rock and determine what's in my backpack so that I don't fall into the water. So
Yeah, I think you delineated a bunch of techniques there. I find that in general, the population is not very kind to themselves, and maybe a cancer diagnosis allows for that. I sure would hope that it would allow for that. But the one thing that we're trying to do with the cancer support community is to offer people ways that they can actively intervene towards a healthier life with capabilities and exercise and self-care and meditation and nutrition and all those other things. So I know it is a very, and some people are dealing with a prognosis that is 100% fatal. And it's still this thing about, you just don't want to leave here with regrets based on something that didn't happen as quick as you thought it would. And I don't even play a psychiatrist on television, so. Okay, I think we've got the questions and comments answered. It was a very well attended and active group, and we appreciate Kerri's comments and appreciate your presentations. Our next cancer prevention and wellness topic will be presented live October 12th at 5:30, again at 5:30. And that will be by a genetic counselor talking about the importance of knowing your family history. And that's still important even if you have had a cancer diagnosis, because the family history, like your personal history, changes, and you might enter the realm of a syndrome where we have to think not only about what we would do differently for you, but also for family members. So important topic, and hopefully we'll see you a month from now. And I'll leave you with a quote, as is usually the case. This is from Judy Picoult, who's an American author, writer, and very popular. And it's about resiliency. The human capacity for burden is like bamboo. It's far more flexible than you would think at first glance. So we have a lot of comments that I believe are more thank yous than anything else, Kerri.
Okay, well, again, I appreciate your attending and your attention, and I wish there was an easy way out, right? I think I just wanted to encourage that it stinks that it has to be individual work. And I'm certainly available to field the ventilation around this topic, and also to talk about tools in more specific terms. So
when we get this recorded version on the Cancer Survivors Park website, Kerri's contact information will be on there as well. So I will give you the rest of the evening back, including our presenter. And my wife's birthday is today, so I better do something.
Right. Thank you. Take care, everyone.